Hi, this is Miranda Ham, and this is my Module 4 video presentation on the skeletal system. This is the name and my name and the date, October 22nd, 2019. And before I start, here's my note sheet with just a list of bones in the axial and appendicular skeleton. So to start, I will start with the axial skeleton, which includes the skull, the vertebral column, and the thoracic cage. So I've taken the skull off the model to make it a bit easier. I'll start here. This is the occipital bone. It is a flat bone. And then moving up here, you have the parietal bone on the left and right, which are also flat bones. You have the frontal bone right here, which is a flat bone, and on either side you have the temporal bones, which are also flat bones. Some of the bones of the face are a bit difficult to see in this. Kind of deep within the skull, you have the sphenoid and the ethmoid, which are irregular bones. Then right here, the jawbone, this is called the mandible. It's also an irregular bone. Right here is the maxilla. You have the one on the left and the right. Those are also irregular bones. And then right here, very small bones right here, these are the nasal bones, which are irregular bones. Then in here you have the lacrimal bones, which are irregular bones. The cheekbones right here, these are the zygomatic bones, which are irregular bones. And then in here you have the vomer, which is also an irregular bone. Then you have the inferior nasal conchae, which are irregular bones. Down here you have the hyoid bone, and on either side here you have the auditory ossicles. Oh, and I forgot the palatine bone, which is also kind of deep within here and right there. And moving on down the axial skeleton, I'll go down the vertebral column. Alright. So this right here is the first cervical vertebra, which is called the atlas. That is an irregular bone. Second cervical vertebra, which is also called the axis, which is an irregular bone. Then we have the third, fourth, fifth, sixth, seventh cervical vertebrae, which are all irregular bones. Then moving down, we have 12 thoracic vertebrae. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Those are all the thoracic vertebrae, which are also irregular bones. And then moving on down, we have the lumbar vertebrae. There are 5 of those. So this is the first, second, third, fourth, and fifth lumbar vertebrae, which are all irregular bones. Then right here we have the sacrum, which is an irregular bone, and the coccyx, which is an irregular bone. And then going into the thoracic cage, this right here is the manubrium, which is a flat bone. This is the body of the sternum, which is a flat bone, and this is the xiphoid process, which is a flat bone. And then in total there are 12 ribs. So the first 7 ribs are called true ribs, and they are flat bones. So you have 1, 2, 3, 4, 5, 6, 7. These are all flat bones. The next 3 ribs are called false ribs. So 1, 2, 3. Those are all the 3 false ribs, which are also flat bones. And then you can see better from the back. The last 2 ribs are called floating ribs. 1, 2. They're also flat bones. Alright, so moving on into the appendicular skeleton, I will start in the upper body, the bones that make up the pectoral girdle. So this is the clavicle, which is a long bone, and then right here is the scapula, which is a flat bone. And then the rest of the upper body, this is the humerus, which is a long bone. Right here we have the radius and the ulna, which are all long bones. And then we go into the hand. So these right here are all the carpals. So you have a list of proximal carpals, which include, excuse me, the scaphoid, the lunate, the trichotrum, and the pisiform. And then the more distal ones are the trapezium, the trapezoid, the capitate, and the hamate. And then moving on, you have 5 metacarpals. So this is the first, second, third, fourth, and fifth metacarpals, and then you have phalanges. By the way, all the carpals are short bones, and all the metacarpals are long bones. All the phalanges are also long bones. In the thumb, you just have a proximal and distal phalanx. On the rest of the 4 fingers, you have proximal, middle, and distal phalanx. So now moving on, we'll go into the pelvic girdle. So this bone right here is the ilium. It is an irregular bone. This right here is the ischium. It's also an irregular bone. And this bone is the pubis, which is also an irregular bone. And going into the lower limb, this bone is the femur, which is a long bone. This is the patella, which is a sesamoid bone. This is the tibia, which is a long bone, and the fibula, which is a long bone. And moving on into the foot, right here we have the calcaneus, which is a short bone. Right here is the talus, which is a short bone. And then right here we have the navicular, which is a short bone. The medial, intermediate, and lateral cuneiform bones, which are short bones, and cuboid bone, which is a short bone. And then similar to in the hand, we have 5 metatarsals. So the first, second, third, fourth, and fifth metatarsal. Those are all long bones. And then you have phalanges, which are all long bones as well. And similarly in the great toe you have proximal and distal phalanx, and in the rest of the 4 toes you have a proximal, middle, and distal phalanx. So that is it for the bones of the skeleton. So in my future career as working with prosthetics and orthotics, knowing the skeletal system is extremely important because that's pertinent anatomy that is dealt with on a daily basis. So, for example, if you're dealing with someone who's been amputated below the knee, it's important to know which bones have been cut. In that case, it would be the tibia and the fibula. It's important to know where they've been cut, and different portions of the bone. So, for example, one of the most common problems in prosthetics patients with below knee amputations is the fibula head. It kind of sticks out a little bit from the skin and can cause a lot of friction within a patient's socket. So it's important to know that structure, what it is, so that you can plan for it while you're building the prosthetic and relieve that pressure and make it comfortable for the patient so that they can walk every day. Thank you. That is it for my video. Goodbye.